ओके, तो आई वाज टेलिंग यू कि व्हेन वी डू टंग डायग्नोसिस, जब भी हम टंग डायग्नोसिस लर्न करते हैं, then we are telling the normal color of tongue is pale red, pale and red. कि जो नॉर्मल जीभ का कलर होता है वो क्या होता है? पेल रेड होता है. दिस द नॉर्मल टंग. सो द क्वेश्चन कम्स कि हाउ द पेल टंग लुक लाइक? पेल रेड टंग. जो नॉर्मल टंग होती है ना, वो पेल रेड ही होती है. हम सबकी जो जीभ है वो पेल रेड है. लेकिन जीभ अगर ज्यादा लाल हो जाए, इफ द टंग इज बिकमिंग टू मच रेड, व्हाट वी आर टेलिंग, हम क्या बोलते हैं कि यांग बढ़ गया कि यिन बढ़ गया? बताइए.
यांग बढ़ गया सर.
अगर जरूरत से ज्यादा टंग लाल हो जाए तो हम बोलेंगे कि यांग बढ़ गया है.
तो स्क्रीन नहीं दिख रहा सर.
हाँ, मैं दिखा रहा हूँ, मैं आपको जीभ दिखा रहा हूँ. ये जैसे कि अभी आप एक ये जीभ देखिए. लुक एट दिस टंग. ये जीभ थोड़ी पेल भी है और रेड भी है. सो रेड कलर इज कमिंग फ्रॉम द यांग and blood is giving red color and yang is giving red color, and pale is the like a fluid coming from stomach. तो आप देखिए, stomach is supplying fluid and pale color. On the other side, lung is supplying. On the other side, kidney, yang is supplying red color, blood is supplying red color. So normal tongue is look like pale red. अदर टंग, अगर आप किसी दूसरी टंग को देखिए, जैसे कि अगर आप सिर्फ पेल टंग को देखें, लाइक यू कैन सी वेरी क्लियरली, इट्स लुक लाइक पेल टंग. इसमें रेडनेस कम है. वी आर नॉट गोइंग फॉर टंग डायग्नोसिस राइट नाउ, मे बी, बट राइट नाउ आई एम टेलिंग यू समथिंग. नाउ इफ यू सी द रेड टंग, अगर आप रेड टंग को देखें, सो यू कैन सी दिस द रेड टंग. There is too much heat or the too much yang creating the red tongue. So now, with the reference of this, now I want to tell you, the red is the color created by blood and the red is the color created by yang. And pale is the color created by stomach fluid and pale is the color created by yin. Pale जो रंग होता है वो yin से आता है. Now, if stomach is good, then there will be pale. Yang and blood will be good, then will be red. Now, if we are seeing the tongue, which is only the pale, अगर हम ये जीभ को देखते हैं जो सिर्फ पेल है, रेडनेस नहीं है, redness is not there, it means yang is deficient or the heat is deficient, so tongue is not red. So when you look at the pale tongue with a cold body, pale tongue with cold body, it means yang deficiency. This is a very clear sign of yang deficiency. कि जीभ का रंग पेल होगा और साथ में शरीर ठंडा होगा. इसका मतलब क्या है? yang deficiency. Not only tongue, even the body. Pale complexion of the face with the cold body. That is the yang deficiency. तो आप जीभ जरूर देखिएगा, क्योंकि अगर यांग अच्छा होगा तो जीभ का रंग लाल होगा. ये क्लियर साइन.
So
If
the
the
red tongue and cold body है फिर.
that is yang deficiency. देखो, टू पेशेंट इन फ्रंट ऑफ, आपके सामने दो पेशेंट बैठे हुए हैं, पेशेंट ए एंड पेशेंट बी. पेशेंट ए इज हैविंग पेल टंग, pale body, pale face complexion, And patient B is also having pale face, pale body, pale tongue. Two patient. But B patient also having cold body. आपके सामने जो बी पेशेंट है उसकी बॉडी भी कोल्ड है, इसका मतलब है कि यांग इनफ नहीं है. दैट्स व्हाई बॉडी इज कोल्ड एंड ऑल्सो body is not able to create the red color. Red color is coming from yang. Is it clear or not?
Yes.
The red tongue and cold body. That
Cold
means
body.
red is yang is more
No,
and
pale tongue and cold body. See, if you tell if yang is more, if heat is more, then body will be hot.
yes, sir.
तो अगर बॉडी गर्म नहीं है, अगर शरीर गर्म नहीं है, इसका मतलब क्या है?
It's cold, sir.
Yin more है.
Yin more है, yang deficiency.
अगर शरीर कोल्ड है तो इसका अर्थ क्या है? अनम्यूट योरसेल्फ एंड टेल मी.
Yang deficiency, sir.
इसका मतलब है यांग डेफिशिएंसी. एक सिंपल सी बात को समझने की कोशिश करिए कि या बॉडी इज हीट, बॉडी इज हैविंग टू मच हीट बिकॉज ऑफ यांग. नाउ यांग इज नॉट देयर, बॉडी विल बिकम कोल्ड. सो द वेरी वेरी क्लियर डायग्नोसिस हियर. हमें हमारी ये वेरी क्लियर डायग्नोसिस है. इन दिस केस द पेशेंट इज कमिंग टू यू with a difficult inhaling, fatigue. So fatigue might be in the yang deficiency. Fatigue might be in any deficiency. Maybe the chi deficiency. Any type of the deficiency. Fatigue might be maybe the blood deficiency. But fatigue is the sign that there is some deficiency. Then cold body means yang deficiency, and pale tongue also confirming that there is a yang deficiency. Right. So now we have reached on the conclusion. हम इस conclusion पर पहुंच गए. The person is suffering with the kidney yang deficiency. Kidney yang deficiency. Right. Now when the person is having chronic asthma, so with the time, suppose the kidney yang deficient patient is coming to you, but kidney yang deficiency can create lower back pain. Kidney yang deficiency can create many other problems, maybe some uterine problem. Kidney yang deficiency might be creating any other problem, but when this patient is suffering with a combination of kidney and lung problems, then it creates chronic asthma. अब इस पेशेंट हमारे को पैटर्न डेवलप हो गया. व्हाट इज द पैटर्न? द पैटर्न इज लंग एंड किडनी पैटर्न. सो किडनी yang deficiency and lung chi deficiency. So this is the pattern, and together it's creating chronic asthma. Now person is having difficult in inhaling and difficult in exhaling. Both is problematic. Now what is the treatment? The treatment will be improve the kidney and improve the lung. दोनों को improve करिए, यही treatment है. Now improve the kidney by Chongmo. Just I told you Chongmo. हम किडनी को improve करेंगे Chongmo के माध्यम से. And we are going to improve the lung by Renmai. Okay. Chongmo से सब हो जाएगा, क्योंकि चोंगमो इज द मास्टर पॉइंट इज स्प्लीन 4, और इसका कपल पॉइंट क्या होता है स्प्लीन 4 का?
P6, sir.
Pericardium 6.
Pericardium 6 will be the couple point. If you see this protocol, in this protocol not written pericardium 6, but you can use it. So how the protocol is started? We started the protocol in the way, let's start with the spleen 4, because as soon as we put the spleen 4, we are doing lots of tonification of kidney. हम kidney का tonification कर रहे हैं, right? And in the last, we are closing the treatment with the lung 7. So Now we also working for
Lung.
Ren meridian. हम Ren meridian पर भी work कर रहे हैं. Here, this is the Ren meridian. The Ren meridian is one of the best meridian who connect with the lungs or the lung chi deficiency. Okay, now. So spleen 4 is the starting point and lung 7 is the closing point for the patient suffering with asthma. In between, we have used many other points, but remember one thing, spleen 4 will be the first point and lung 7 will be the last point. हम जब भी point लगाएंगे हम इसी क्रम में लगाएंगे. Spleen 4 will be the first and lung 7 will be the last on the opposite side. Right? Now, very important information. During the discussion of this kidney points, we have told you there are many points found in the chest, like kidney 22, kidney 23, kidney 24, kidney 25, kidney 26. 22 to 26. So they are the point, very good point. Kidney 22 is the point of kidney, then the spleen, liver, heart and lungs. ये हमारे किडनी 22 से लेकर किडनी 26 तक के पॉइंट हैं. ये हमारे 5 एलिमेंट्स के पॉइंट हैं. ये सब के सब छाती में पाए जाते हैं. So let's see here the location of the kidney 26. The kidney 26 is the very special point for lungs. So let's see here in this image. So in the kidney meridian, we are discussing generally kidney 1 to kidney 27 point, and this is a kidney 26 point. The kidney 26 point is very good point for this purpose. We are using it, right? Kidney 26. Quickly, I will show you the location here. So we can see here this in the below the first rib, kidney 26. ये हमारी पहली रिब के नीचे पाया जाता है, kidney 26. Okay. So kidney 26 is the point for lungs here. Then 25 for heart. We are going just below that. Then liver. So we can see here. So if we go for the next point, there is a 25, there is a 26, 25, 24, 23, and 22 point. So this 26 is for lungs, 25 is for heart, 24 is for liver. In this way, we can see all the points here. 23 is for spleen and 22 for his kidney. So in this image, we can see starting from the kidney, then the spleen. So here, if you see the kidney 22 point. So kidney 22 points found exactly in the, it's very near to nipple. How to look at this point? Let's see this image. So first we are going near the nipple area. Nipple located below the 4th rib and this point located below the 5th rib. Kidney 22. ये हमारा 5वीं पसली के नीचे होता है. Kidney 22. And the kidney 22 is very, very effective point for kidney. ये हमारा kidney का बहुत ही special point है. Kidney 22. It's found below the 5th rib, just below the nipple level. We are stimulating this point with the help of cupping, with the help of acupressure, massage or reflexology for the patient having kidney problem. This is a very good points to improve inhalation, जो inhalation को improve करता है. And if we go just upper, there is a kidney 23. अगर हम इसे ऊपर गए, kidney 23. Kidney 23 located at the level of nipple exactly, half turn away from the central line. This is a very good point for spleen, and we know spleen is very, very effective for allergies. Spleen is very effective for many things. We know that. ये हमारा spleen का point है. Okay, I will correct one thing. The all points in the chest located 2 chun apart from the central line. ये हमारे chest के जितने भी point हैं, ये 2 चुन की दूरी पर हैं. Let's see here. Abdomen में वो half चुन की दूरी पर होते हैं, but the chest region they are the 2 chun apart. So kidney 22 for kidney 23 for spleen. As we go up, kidney 24. So this is the point at the level above the nipple. Nipple के अगर हमें ऊपर जाएंगे तो हमें point मिलेगा 2 chun apart. Like so, kidney 24. So kidney 24 is very good point for liver. It's a wonderful point for liver. Rebellious chi of the liver when liver chi is not in the control. This is the kidney 24. Now we are going further up. That is the kidney 25. Now further we are going up below the second intercostal space. In the second intercostal space, below the second rib, हमारी दूसरी पसली के नीचे यह बिंदु पाया जाता है. That is kidney 25. It is a very good point for heart. So we can stimulate this point for the heart region. It's a 2 chun apart from the central line. The central line से 2 chun apart होता है. And finally we have discussed about the kidney 26 point. So kidney 26 point is one of the great point for lungs. We are using it for regularly for asthma. When the person is suffering with the asthma attack, we do cupping here or we do massage here, and we can see the quick effect in the asthma. Even the person is suffering with the cough and cold, we can the massage or we can apply the herbs. The all point 2 chun apart from the midline. हमारी midline
मोक्सा
से
दे सकते हैं इसमें.
2 चुन की दूरी पर होते हैं.
तो
So
मोक्सा
when
दे
we are
सकते
making
हैं.
the protocol for the chronic asthma, we started our journey from spleen 4, we ending our journey with the lung 7, but we are definitely applying the kidney 26 point. हम kidney 26 point इसमें लगाते हैं. Why we put the kidney 26 point? Because it is the point of lungs. Okay. So in this way, spleen 4, lung 7, and kidney 26. Now here, REN 17 is a very good point in between the nipple. REN 17 is also a very famous point for the catgut. Many people are doing catgut here for the asthma patient. REN 17 is the very good point for asthma or any lung problem. And REN 17 also very good point for the heart. So we can tell REN 17 is the very good point for any problem which is happening in the chest region. हमारी छाती में होने वाली किसी भी प्रॉब्लम के लिए हम इसका प्रयोग कर सकते हैं. So this is the REN 17. We can see here between the nipple. It is a very, very important point for this is the influential point of chi. इसे हम कहते हैं chi का point, ऊर्जा का बिंदु. Right? The point of chi. The influential point of chi. If the chi is excessive or deficient anywhere in the body, we can work with the help of this point. And there's a special point for chest cavity, a special point for asthma. Exactly in between both the nipples, दोनों निपल के ठीक बीच में पाया जाता है. Then here we are using some point for reinforcing the kidney. अब हम किडनी को ताकत देने के लिए REN 4 का प्रयोग कर रहे हैं. REN 4 is very good point to reinforce the kidney. किडनी को reinforce करता है. It's a very, very effective point. Right? And stomach 30. Stomach 30, even if you remember, we have discussed many protocols, spleen 4, pericardium 6. That time I told you, use the stomach 30 point. Stomach 30 point can be considered as a very good G cleft point. ये एक बहुत ही शानदार G cleft point है. जो चोंगमो के साथ बहुत अच्छा काम करता है। व्हेन यू लुक एट द रूट ऑफ द चोंगमो, जब आप चोंगमो का रास्ता देखते हैं, सो द सेकेंड ब्रांच ऑफ द चोंगमो फ्लो थ्रू द स्टमक 30। ओके, दूसरी ब्रांच जो चोंगमो की है वो स्टमक 30 से फ्लो करके निकलती है। देन वी कैन सी हियर फ्रॉम द स्टमक 30, देन इट्स गोइंग अपवर्ड क्रॉसिंग द लंग्स। सो यूजिंग द स्टमक 30 इज द पॉइंट। सो स्प्लीन 4, stomach 30, these all points are, and kidney 26 can be considered in the last lung 7. These all points are very good. Starting our journey from the spleen 4, as soon as we activate the spleen 4, we are working on many kidney points like kidney 11, kidney 12, kidney 13, 14, 15 and all. Then we are also stimulating the stomach 30. Stomach 30 is the point coming in the pathway of Chongmo. Chongmo के pathway में आता है. If there is any blockage, if there is any disharmony in the path, it will open up. The kidney 26, one of the great point for lungs, just we have seen. So we can use this point for all the problem of which is connected to the lungs. Then REN 17 is the very special point for lung and chest cavity. REN 4 is for reinforcing the kidney. REN 4 एक tonification point है. And we are closing our treatment with the lung 7. Here we have taken one point, stomach 42. Stomach 42 is the source point of stomach. ये हमारे stomach का source point, stomach 42. So when we are stimulating the stomach 42, because our Chongmo vessel, the fifth branch of the Chongmo flow to stomach 42, down to the big toe, and connecting the Chongmo with the two another vessels, हमारी Chongmo को दूसरी vessel से connect करती है. So we are stimulating the stomach 42 here because it is coming in the root. We are stimulating stomach 30 because it's coming in the root. We are stimulating these 2 points by using these points. If the person is having some problem in the legs also, suppose leg pain or asthma problem with some other complication, we will able to treat it. So this is the final protocol. Now we have understood the entire protocol here. So let's see here. Spleen 4, stomach 42 and the stomach 30, they are coming in the path. Kidney 26 also very good point for lungs. REN 4 in reinforcing kidney. REN 17 reinforcing lung. Lung 7, we are closing the treatment. Use this protocol for any patient who is having this problem. आप किसी भी patient को ये point लगा सकते हैं. Here it's written very clearly. When we are stimulating spleen 4, Chongmo and the stomach 30. With the help of this point, you can stimulate multiple points of the kidneys. With the help of this point, you can remove the blockage if there, and you can reinforce essence and chi. Here, kidney 26 and the REN 17 is special point for lungs. Kidney 26 or REN 17 lungs के लिए काम करेंगे. REN 4 will be working for kidney here, and lung 7 is the point for REN channel, and this is also balancing yin. So in this way, because this patient is having chronic asthma with the lung chi deficiency, we will tonify all point. हम सारे point को tonify करेंगे, whether the spleen 4 is the first point or the lung 7 is the last point. हम सारे point को tonify करेंगे. Okay. इसमें एक additional formula है जिसके बारे में मैं अगली क्लास में डिस्कस करूंगा. So there is additional conditions जिसके बारे में हम commonly बात करेंगे, because this additional condition can be applied for any case. So enough for today.
सर इस पे डोमिनेटिंग साइड यूज करना है, लेकिन दोनों को दिन भी कर सकते हैं सर chronic stages पे.
Yes, so we will use the master point of the dominant side, like spleen 4 on the left side, and lung 7 we are using on the right side. Okay, we can also do a spleen 4 tonification, like we are doing spleen 4 tonification on the left side for the male, and we are closing the treatment with the lung 7. And because this patient is having severe yang deficiency, we are not sedating any point. इस पेशेंट को अगर जब भी हमारे पास कोई पेशेंट आता है, ओल्ड पेशेंट है, वेरी वेरी क्रॉनिक पेशेंट्स, very, very deficient patient, we don't set it any. Okay. We use the point on the, sometimes we are not able to understand what to do, then we do even method. Spleen for definitely tonification. That is 100% sure. All the point, even method. जितने भी point हम even method कर दो, and lung 7 also you can do even method. This is a very good approach. Spleen 4 on the left side, lung 7 on the right side, all other point bilateral. It's very clearly mentioned in this protocol. आप ये देखिए इसमें clearly लिखा है. Spleen 4 left, lung 7 right. All the other points are violet. Got it?
So this protocol
Yes.
can be used for heart patient also because
We can use, but
hello.
yeah, actually this protocol will work for heart patient also, but for the heart patient we will discuss other protocol. Okay, but definitely because we
Sir,
can, spleen 4 is here, right? In place of kidney 26, we will do kidney 25, right? And
Yes, sir.
stomach 42, 30 is very good. We can work because they are the point of path. Okay, so kidney 4 is good. RAN 17 is good, definitely. So lung 7, in place of lung 7, we use pericardium 6. So then it will become the protocol for the heart. So for the heart patient, spleen 4, stomach 42, stomach 30, kidney 25, RAN 4, RAN 17, and pericardium 6. So with a little bit, we can use this point for the heart.
In this protocol, we are using both the master points.
Yeah,
So one should be on the right and one should be on the left to complete the circuit.
yeah. So we are using one on the left side, lung 7 on the other side. If you seen yesterday, also we discussed for the female, we have used SI3 on the right, lung 7 on the left. So this is
Yeah, and what
Yeah.
should be the order like in the yesterday's protocol, which you have said? SI3 first and UB62 will be the last point. So
Yeah,
lung
yeah.
7, kidney 6 sequence, what should be
Here,
that sequence?
spleen 4 will be the first point, lung 7 will be the last point. Other point in between, the point in between can be put in the different order also. But spleen 4 will
Okay.
be the first point and lung 7 will be the last point.
And what about yesterday's protocol, SI3?
Yeah, definitely. Yesterday I already told we have to put in the sequence. कल मैंने बोला था कि
SI3, LU7?
no, no.
सीक्वेंस
Say
शायद
3
नहीं बोला है
UB62.
Yeah.
UB62.
So what we'll do?
बीच का सीक्वेंस नहीं बोला है
हाँ,
उसमें
बीच का सीक्वेंस वही है SI3, then lung 7 और lung 7 को हम क्लोज भी कर देंगे. लास्ट में लगेगा UB60. SI3 is the
and
first point.
U3
Lungs, SI3 will be the first point, UB62 will be the last point, all the point in the between.
okay lung 7 if we are using the second master point then we can close it immediately
Yeah, we can close it again.
and then put the other points like U3.
Right.
Okay, thank
Which
you.
is the main master point, the closing point of that same in the last. Okay?
Okay, yeah, fine, thank you.
तो चलिए आज की क्लास को विराम देते हैं. अब let's close the session. See.